Technology is fun, isn't it? Hey guys. Well, let's recap real quick before I go into what today's show is about, because I know, as you can see from the title, it's titled Polycystic Ovary Syndrome, but not really, because we have some good news coming soon. But I wanted to recap real quick that we did get word back from one of our people, Michelle. She did the test and everything, and she got Advocate. So we'll have an upcoming show to explain what happened and everything and let her explain how she feels about being an advocate, where I'm a logistics and Christian is a commander and Reverend is a adventurer, if I remember correctly, and stuff. So, but today's episode is actually a new hope for women, a new hope for an idea that basically we have been praying for. And polycystic ovaries, see, I can never do it right. Okay. Polycystic ovary syndrome, or PCOS, actually got renamed this past May 12th in the Lancet official announcement 2026. Now it is called Polyendocrine Metabolic Ovarian Syndrome. Now, what does that mean? Well, after years of hell, finally proof that I can show people that I don't drink too much soda or overeat. And a lot of women go through this, because do any of you want to listen to doctors anymore? And like I'm saying, I'm not telling you not to listen to doctors, but I say always fight for a second opinion, fight for a third opinion, fourth opinion, because you know your body. They're not there with you 24/7. And you do need, like, if we have our disclaimer right now, I don't know if we can put it on the side or anything, or really quick to explain to people what's going to be happening. As you see, this is the disclaimer. I am not here to give medical advice. This is based on my experience dealing with PCOS that I was diagnosed finally with, and it just cleared up a lot of things. And this episode is sending hope to those people, those women that were told that go on a diet, go on this, go on that. So this disclaimer states, and we're going to read it again, disclaimer, this is not medical advice. This is my personal experience, and I am sharing this in the hopes of helping others feel less alone in their struggles, because I will tell you my struggles. I will tell you the pain of everything. I will tell you how bad it is, because my doctors and my nutritionists and everything over the years have been trying to figure out how I was triggered with polycystic ovary syndrome, or now PMOS, which is polyendocrine metabolic ovarian syndrome, because it hurts. There's a lot of side effects with this that people just don't understand, and everything. So first, I know the Reverend wanted to show off something really cool before we begin. And he tried to show it off on the TARDIS earlier tonight, because we had just left the TARDIS. And that's why we're starting late, because they ran late and we were trying to get everything together. So does the Reverend have his surprise that he's showing everybody that he found today? That he didn't get to show? Because I'm an equal opportunity person.
Yeah, I was at Target today, and I don't know anyone. I know Gadget. And I saw this, I had to do it. So I was at Target, sitting on a shelf, so brand new. The Godzilla versus Mighty Morphin Power Rangers 2, which I didn't even know there's a first one.
Mm-hmm.
Kaiju Ranger, Green Godzilla.
That looks gorgeous.
Because it was Tommy from JDF.
That looks pretty cool, yeah.
After combining forces with Godzilla and a host of other beloved kaiju, the teenagers with attitude have become the strongest heroes in the universe, the Kaiju Power Rangers. So they did not have pink or yellow. They did have red and green. And they had blue, not black. But of them all, I had to get because it was Tommy.
Mm-hmm. Shout out to JDF and the family.
Godzilla. I'm not sure if I would get Godzilla with the dragons or whatever, but yeah.
No,
For this price, it's like I had to just because it was JDF.
Mm-hmm.
So I had to sneak that on another show.
But are you? Let's for the men out there, since you are representing the men, right?
Manly men.
Explain to them that you are not afraid of this topic.
No.
Because what is your impression of this topic after I had you look it up and understand it and everything?
Let's see. Well, I have
because you have
couple
seen me
pictures.
struggle and you've watched my weight go up and down throughout TARDIS and everything. And, you know, like you've seen the pictures, even in my slideshow in the introduction, you know.
I mean, everyone has medical issues of something. I mean, it's most recently from my skin being torn up. I don't know what's going on because of nurse practitioners saying, well, it could be this, could be that.
Allegedly.
Oh, yes, allegedly. Nurse
Put the alleged
practitioners
sign up.
allegedly stating that could be this or allegedly could be that. So I had to go see a dermatologist, which, you know, find out.
But I'm saying is like, how many times have you been told, go do this, go do that, and it doesn't work?
Yeah. So for when I see them, I'm expecting so many diagnoses, which you can look up online. WebMD was the biggest thing in the world because like, oh, you can find everything you need. No, not necessarily.
Nope. WebMD. I'm just like, right now, guys, I'm checking our chats and everything. I see we have one chat. I'm trying to figure out who it is. They're on the phone. I think the phone is the most, you know what I mean? And stuff. And I guess because it is late at night, we are getting Europe more than we're getting, because that's 5 hours. What's 5 hours from 9 if you go based on England? That is
2 o'clock in the morning.
2 in the morning. And then if you go further, it should be like, you know what I mean? 6 hours is Italy, you know, and stuff like that. So it might be we're getting Asia, Japan right now and everything. You know,
and could be anything, but you know, thank you for watching.
Because I don't, like I said, as long as your channels are not like messed up, fake, or you're trying to scam something, you're more than welcome, because we don't feel that, like, if you want to learn something or get to know us or anything, don't cheat yourself out of it by being fake. You know, we get a lot of people that do that, and it's not right and everything that you want to, you know. And we always tell everybody, don't steal from others, don't whatever, you know, because right now, especially with this topic right now, it has hit major things like the Lancet. Now, doctors' offices are going to have to wake up to women because all these years, you know, and my doctors couldn't figure it out. And if you hear any screaming, that's just New York. We'll give you that. Okay. And stuff like that. Yeah, I know somebody just screamed outside. So if you hear it, yeah. Or if you hear fire trucks or anything, don't worry. This is how New York is like right now, allegedly. Okay. Do we have our alleged sign? Because tonight is going to be alleged stuff, because once again, we're going to put up the streamer again that says what this is about and the disclaimer that it's my story. Okay. This is my personal experience, okay? It basically is saying, disclaimer, this is not medical advice. This is my personal experience, and I am only sharing in the hopes to help others who feel alone in their struggles, okay? Because I know how devastating this is. All right? And I want you guys to remember, this is my story. This is how it goes. And I would love to turn that friggin' fan off and everything, but it is almost 90 degrees here in New York. And yes, I have eavesdroppers and everything, but if they want to pay attention, just tune in and give me a like and subscribe. You know, you want to know my life? You think you know everything? You want to, you know what I mean? Just like and subscribe. And meanwhile, you're freezing again, Reverend.
Oh, yeah?
Yeah, which means is somebody trying to elude again? Because the last time, remember, we talked about this, you were fine for TARDIS and everything, and now magically, when you try to do something, your page gets all messed up and everything. You notice that? So I'm hoping somebody is not, you know what I mean? Yeah.
Just get myself out of this one and got a new window.
Yeah. Before we begin. Because I would love to share this to other channels and everything right now, but for some odd reason, Okay, so we're going to keep that up there so you guys know everything and stuff, okay? Because right now, it's a disclaimer, it's everything, you know. And Facebook has changed a lot of stuff. Interesting. Okay, so that's a change. Meta is like, yeah. Okay, while we wait for the Reverend, because we have to remove this disclaimer, and I'm going to keep the disclaimer up because of everything. Okay, you ready? Better? Wi-Fi reset?
Oh, no, I just got to a new window.
Okay. So let's
Never
take
moaned.
this down and tell everybody, like, basically everything. Because, like I said, you're representing the men right now because you know, it's medical advice disclaimer too. I know we can't really see it, but can we read it to them?
I'm going to read it through the computer because I cannot read it down there. So I downloaded it.
Yeah, we didn't think it was going to go
So,
that small.
okay. The views and opinions expressed in this program do not constitute medical advice and should not be used as a substitute for professional medical consultation, diagnosis, or treatment. Always seek the guidance of a qualified healthcare provider with any
Qualified.
questions. Yes, qualified healthcare provider with any questions or concerns about your health or medical condition.
Okay. And it says qualified because right now, allegedly, there are not a few qualified ones out there. You know, I mean, I've been sitting with an ear infection for over 2 years. Yep. Well, hello. We didn't see you in a while. Okay. So, what happened and why are we talking about this? Well, like I said, May 12th was a groundbreaking day. Now, those of us that have PCOS or polycystic ovary syndrome can tell you the horrors of it. When you try to talk to your doctors, everything, and nothing works. So after, I'm thinking somebody must have got it famous. That's why they're actually pushing it, allegedly. But now it's called Polyendocrine Metabolic Ovarian Syndrome. And it was in the Lancet. I read the article, and the medical community, they want a 3-year rollout on it. All right. And what hurts about this is there shouldn't be a 3-year rollout. It should be talk to your patients and figure it out now. You know what I mean? Talk to your patients, figure it out now, because my situation was this. We don't know if it was hereditary. We don't know if it was because I had gotten shot with steroids for my knee during puberty. We don't know if it's from a vaccine I got back when in the 90s, that there was another alleged pandemic at the time. Alleged. Called the Beijing flu, but we'll go, it's hard to find about that. But it is located in the CDC. You can find it in the CDC. Okay? That I will tell you, because when you get a phone call about that, yeah. So, basically this. So, my story is this. I've always had problems with my menstrual cycle. It wasn't right. I thought at 12 I had gotten, but it was really 16 and all this. And we couldn't figure out what was going on and stuff. My weight would go up, go down. I went from, that's why we're thinking it was the steroids, because when I was around puberty age, my knee got messed up because we found out later it was from years later. That's what I'm saying. You got to talk to doctors and get 3-4 opinions. But years later, we found out the Cipro had caused, I had gotten a side effect, and it caused my knee to disintegrate. And that is one of the side effects. The only reason we found out was a fireman on the news couldn't understand why when they gave him Cipro, he couldn't or anything. And it turned out some people are very sensitive to it. So I cannot have any of the oxafloxacin family, okay, which is Cipro and some other drugs, okay? So they put me on steroids, not thinking it was that and everything and stuff. And I ended up high school from freshman year through junior year, before we figured out about the steroids, big balloon weight, couldn't get it to go, nothing. My uniform skirts could be curtains. That's how heavy I was. And you know how embarrassing it is also too that your mother cuts your hair so short? and everything. And then I also had a Carol Brady haircut and everything. So that did not help. Okay. So my weight then would go up, down, and everything. Come end of junior year into senior year, I get really sick and we don't know what it is. And all of a sudden, there was like a slight pain in my side and weight came right off. I went from almost 260 to 270 down to 123 pounds. My school sweater could be wrapped around me. Like you see the pictures in the yearbook of the difference. You know what I mean? Everyone was like, what the hell happened? Then one doctor said, oh, she went through puberty. They said, no, she's going to be this, because I never looked my age. I always looked younger. So we don't know if the steroid had stopped that or whatever, right? And everything, because it was just like, big change. College was okay, but it would go up and down and everything. And I always had problems. Very high cycle, like the cycles were heavy, everything. The weight, and I would be I'd be drinking water or eating a piece of bread or anything, and my weight couldn't come down. And we couldn't figure it out. I was very active as a kid. I was whatever. Right? So all these things that were going on in my childhood, we think played a part in this. So you're fast forwarding, you go through college, everything, and then all of a sudden, I'm like, okay, out of college, I start acting. And I met a lot of good people. My doctors were like, okay, you need to get the weight off. You're still puffy in the cheeks and everything. The actors were like, we'll just get you a little thinner, right? So here was the thing. I was starting to get more active, meaning I was active before. I mean, mom would drive everywhere and stuff because of her narcissism and everything and stuff like that, right? But I would get more active because now I'm going down to the city. I'm walking around. I'm up and down stairs. I'm getting my metabolism, right? My metabolic rate was going up. My heart rate was going up. Everything was basically starting like, you know what I mean? And then all of a sudden, I'm getting thin again. I'm bound to, again, 133 was my goal weight because I stayed about there. As long as I stayed at 133, I was good. I would go to 120. I would go up. Like I would go, right, everything. But I stayed at a good weight. And I was always walking around the city, doing things and stuff. And the metabolic. Then stopped acting and I went to work at the most high stress job you could ever think of. Let's put it that way. Especially with the alleged supervisors I had. Okay. But I was still doing acting when I could until I was also waitressing. So I was still active, eating right and everything, because also with my allergies, I can't have certain chemicals and stuff. I have to like test things before I can have them. That's why people look at me strange that I can drink this, but I can't have, and stuff, because I've tested things over the years. I got immune to things, like poison, you get a little bit immune and everything, right? So we were trying to figure out things. And then again, because of the stress, because of everything, and I wasn't walking like I was at the job, I blew up again. The stress. So we were trying to figure out what happened. They said, that's enough. We had enough of this. Okay. Tried diets, tried everything. But my cycles, I was getting pains. I actually have had an ovarian cyst removed. I found out I have fibroids. I found all this stuff. And the same thing everybody was seeing. They're seeing little air bubbles, little dots and everything. Now, an ultrasound tech who can't read an ultrasound, I love, because I know on my ovary I have the little dots like you see in those pictures and everything. And Reverend, I hate when I finish this, we're going to show them what I'm talking about, because a lot of people might not understand what it is. Okay. This type of disease, as they were putting it, starts in puberty. Okay. So you have to be at least, they said, hormonal age. So that would be like anywhere from now 12, but back when I was there, it would have been like 14 through like 18 for girls, that puberty age and stuff. So it's not cysts on your ovaries. That's just one factor in it and everything. It also causes infertility in some people. It causes many things and stuff. It's just sad because a lot of the doctors just keep telling everybody it's anxiety. Oh, go lose some weight. Or like my family says, you eat too much. You drink too much soda. You drink whatever. Not realizing that it's my metabolism. If I don't stay active, this is what happens. And certain foods also can trigger it. So I had to be put on like a strict nutritionist type diet and everything. And it was working. Even natural herbs and everything were working. I'm not going to tell you which ones I take because some people might be allergic to them. That's why this is not medical advice. Again, please put that up again. The disclaimer. I'm going to be talking about the medical part, like what I like my medicines and stuff. Okay. Once again, people, because we're dealing with people that need to go Outlander back to the 1970s. How about that? Trust me, people, if they ever hit their hands on the stone, they would not know how to survive. You have a better chance if you're born in the 70s to survive Outlander than you would if you were born, like, because guys, no deodorant. Think about it. Would you want to go back there with no deodorant? So basically, this is what happens. I go to a nutritionist. They do blood workup. They do everything because I'm also anemic. I'm all this and everything, right? We find out that it is my metabolism. It is what it is. And that's when they diagnosed me with polycystic ovary syndrome. But they focused more because I had dermoid cysts, fibroids, all this other stuff. Because every time one would rupture, I would lose weight or this or anything. Stuff like that. Nobody could figure out. 1 minute I'm in the thinnest of clothes. The next minute I'm right now like I am in an oversized shirt, wearing stretch pants or pajama pants because none of my clothes fit me right now. So how does that make you feel? Well, you get depressed. You get tired. You get, now, especially with me who has physical, meaning my knee and other injuries and stuff. I have like, God, I have to, like, people don't understand. Like, I can have the same injuries. That's another thing too. Take the disclaimer down because I love when people say you can't copy my injuries. You've ever heard that one, Rev?
Mm-hmm.
Okay. I can have the same injuries as you if I'm describing my situation. Because the only reason I didn't know I had like basically other injuries was because I was also on naproxen, 2,000 milligrams twice a day. That's That's how bad the pain in my knee is. Okay. So I have, let's see, I have fallen so many times because I have a balance problem. I have been dropped. I have been tripped by people. I have been, I have had a lot of injuries done to me. And the ramifications are I walk with a cane. My knee is messed up. And it's sad because I love playing baseball. But over time, it just wore down because of the Cipro and everything else. Actually 2 bad ankles, but the right one is worse than the left because I broke the foot in my right foot with my toe and everything. So, and then I also got, when my mother was blowing a whistle out in the hallway and I'm watching her on camera because she's fighting with the neighbors, I fall off a ladder into a dresser and I have, during the pandemic, by the way, bad back with a twisted ankle that has a lump this big. Okay. Yeah. So, and plus I had no insurance at the time because my high stress job, which was causing even more stress on me, was screwing up my medical because the girl put the wrong button and messed up my accounts. Because as a per diem for my job, we were hourly workers, not set to a schedule, but they thought I was. That we don't have days off or anything. We only work the hours and get paid for the hours we do. So time and attendance didn't apply to us per se, only when we were there, Otherwise, it would have been an okay job if it wasn't for the stress. So what happened now, right? Why am I talking about this the way I am? Because growing up, nobody knew. They just said you were heavy, you were this, all that. So when I got diagnosed with it, my doctor's like, okay, let's get her on a routine. Let's get her whatever. Once I started that routine, I had my levels. The only thing I was missing was my B12 because I cannot take synthetic B12. I have to have natural. This is how bad I am with chemicals and everything. I got to have everything natural. That's why I said I have to test the chemical stuff. That's why I can have this and not have a problem because I've tested this. Trust me, I can't have seafood, shellfish, anything like that. I can't have, because they don't know if it's the high concentration of iodine, or is it there's a parasite in some fishes, you know what I mean? Or I also cannot have lab grown stuff. So this engineered food that you see in the stores, make sure you check the back, because my dad just threw out the box to the cheese sticks that we bought. Not going to say which store, but it says has bioengineered food. I can't have that, because the box I bought weeks prior did not say bioengineered food. It actually said real cheese sticks and, with real cheese, mozzarella, and all that stuff, not bioengineered. Okay? Because society thinks everybody can have the same thing. And that's why this here throws a monkey wrench into the doctor's things, because they're not trained in anything for that. Like I said, I was told basically go lose weight, go take some diet pills, go eat less, go whatever. I'm a person who would rather eat a salad than a steak. Okay? I'm part vegetarian because of my great-great-grandmother. Okay? Because all she ate was rabbit food. They used to tease her, lettuce, tomatoes, peppers. You'll see me eating a pepper with salt on it. That's what I eat. How am I blowing up like this? Okay? So, got my routine, got everything taken care of, and I was doing good. I'm on my natural herbs. I'm on, stuff that heightens my metabolism. So, me walking 2.2 miles to work with my cane, that's why I had to be careful with my knee and my ankle, because I also ended up in a boot, which is next door at my parents'. Basically, that was helping the metabolism keep going, while the herbs, meaning the herbal remedies and everything that are natural herbs that they did find works better than the actual medication. Because you got to remember, all your medications today started with a plant. Because willow bark is aspirin. Okay? And if you watch Medicine Man, you'll see about that too. How the ants were the cure for cancer in the Medicine Man movie with Sean Connery. Okay? So everything was good. Now here's where you can see what happened. Right before I was let go of my job, and go watch back on that one, I had to have physicals and everything and stuff, because I finally had gotten medical insurance, because it took 3 months for them to correct my medical insurance. My doctors had run so many tests and everything, and basically we found blood workup was good, levels were good, I was thin. If you go back to TARDIS's, some of the screenshots or some of the other shots, you'll see thinner face, it would be like a little thinner, like that. Everything was good except for my B12, and that's all I needed to fix, right? Then I listened to my mother and eat a calzone out of the microwave, which got stuck. And for 2 days, I couldn't get it unstuck. It was preventing, right? So I end up going to the hospital, which means I had to stop my medications in case of surgery or anything, because you don't want it to mix with the anesthesia. You don't want it to mix with whatever, because they were trying to figure out why I could still do things and be in pain. And that's a later show about narcissists and pain and stuff, and how you hide your pain and you have to be multifunctional, because if you show pain, they go right at you. Then all of a sudden they end up in pain, or, oh, I'll give you something to cry about, or, stuff like that, and things. So that's another story. So the problem was I had to be next door because of her paranoia and everything, plus other stuff that was going on at the time too. And she decided she was going to smoke in front of me when the doctor told her do not smoke in front of me. But she said, you were sleeping. I tested you. I was like, so it took a while for everything to heal. Because remember, they had to remove what was stuck. So I couldn't swallow. I couldn't, and all this stuff. So all my medications, I tried drinking tea forms. I tried everything. Nothing. Wasn't the same. My doctors were like, okay, let's just get you on the diet. Let's keep your diet going. But guess what? My parents don't eat what I eat. So I didn't know what to do. And then I went back to the processed foods that I'm not supposed to have, the ones that I could tolerate, that don't give me as much agita and everything. There wasn't a lot of fruits because they would go bad right away over there. All the other stuff, because I had not been in here. I've been helping take care of things over there, trying to get my health back. And then I go and lose the job, which also caused more stress and all the other stuff and everything, which then adds to it because stress plays a part in PCOS and now PMOS. Okay. So I was hit very hard since the middle of 2024 because of what they were doing to me at the job, home life, everything, the hospitals, everything, till today, meaning 2026, to the now where it's like I can't fit in my clothes. You guys can see I'm a little puffy. I'm wearing oversized clothing again. One person said I look like I was pregnant, and by the way, this also makes us infertile too. It's hard to have kids when you have this also, depending on case by case, but there also was other factors that led to mine. So yeah, but it's sad because a lot of people just keep getting misdiagnosed with this, telling them that, oh, just stop being anxious, stop being whatever. It's all in your head. It's all, and that hurt. That really hurt because I was doing better and my friends could see it, everything. Everyone could see I was doing better. But thanks to being taken off of everything, I'm now puffy again, my swelling, everything. I'm having more regular cycles, more heavy cycles, more, right, and everything. And then you also have to play in a factor of my age as well. And all this other stuff, like I'm starting, like, I know you guys cannot see it, but I can feel it right here. There's the hair here. There's a few hairs here, like that's what I'm saying. It's like, and then there's a running gag joke because I'm half Italian. It's normal. And I'm like, no, it's not. This is the high cortisol, high androgen, high everything in our bloodstream. So that's why spearmint tea, all the other stuff that you see on these things do sometimes work, allegedly. But it depends on case by case. They're saying berberine, they're saying all this stuff and everything. And I'm like, no, it's case by case because the stuff I'm on is not what they're using and it actually worked. So from my body type and everything, what I take works. For somebody else, the other stuff may work. But spearmint, I've always drunk spearmint tea. It is really nice. You mix it with green tea and everything. That's why I learned like I love it being apothecary stuff because, and people like, oh, you're just copying because apothecaries is out and everything. No, sweeties. I have an apothecary book over there. I have always been into flowers. My grandmother would grow them in the yard. My grandfather had a garden. I'm older than I look, and stuff like that. And I know what the medicinal flowers are because of being allergic to everything. Okay. I mean, he took a leaf one time. I got bit by a mosquito and my grandfather put it on me. He says, this is what we did in Ireland. He put it on me, and stuff like, so it's a short version of my story of this because I don't want to get people to think that this is you know what I mean? And stuff like that. But I want to explain what it is medically. So do we have like the actual Lancet article or do we have the, because that was my story. And I'm
also the Lancet website.
Yeah, put the Lancet website up, but the article should have been dated May 12th, 2026 via landmark consensus published in the Lancet. So I'm trying to pull it up and I can't because of my things right here. And the funny part is, if you look at why they changed the name, right? It said for decades, the term PCOS caused confusion and delayed diagnosis. Yes, it did. Oh, yes, it did. Because many patients did not actually develop ovarian cysts. See, case by case. I had the ovarian cysts, which is what threw them off, right? The new name designates and highlights the syndrome's complex system affecting on fertility, skin, insulin resistance, and long-term metabolic health. Once I started getting active, once I started taking the stuff I take, once I started, things fixed itself. But I had the cysts because that could have been from the other things that were done to me. Could have been the steroids. It could have been, did you find it? There it is. Okay, so this is a real article. This is what I don't like about people who think that when we talk about stuff, it's not real because they don't have the receipt for it. Okay, this is hard to read for me and everything because of being dyslexic as well as everything. But this is the summary of it. You know, if you want to check this out, we should have the links for it in for you guys. We'll put it in the comments. We'll put it whatever. But read this article because doctors now have 3 years to wake up to this and figure out how to re-diagnose all their patients they sent away. You know? Because too many of us were dismissed. Yes, I had ovarian cysts. I had dermoid cysts. I have fibroids. Yes, that could be hereditary. That could be the steroids at puberty. That could have been whatever. But here's the thing. Androgen levels are high. You have all this stuff, right? And some cultures are prone to this because of environmental. So you can get this via environmental, hereditary, and it's sad because there's a lot of doctors that dismiss people, including me. And if it wasn't for my 2 doctors that didn't dismiss me, and then the nutritionists I found because my friend recommended them because of my allergies, and then other friends who have Chinese herbal medicine doctors and all this stuff, you got to think outside the box for your own sake. Get your opinions, get everything, but this is a real article. This is really happening, people. We have a new name, and doctors need to wake up. Okay? Because it's not right. Like, Reverend, can you read it because you have a better screen because it's on your screen?
Yeah.
Yeah.
A summary of Polyendocrine Metabolic Ovarian Syndrome, PMOS, previously named Polycystic Ovary Syndrome, PCOS, affects 1 in 8 women. However, the term PCOS is inaccurate, implying pathological ovary cyst obscuring diverse endocrine and metabolic features and contributing to delayed diagnosis, fragmented care, and stigma, while curtailing research and policy framing. Building on an international mandate for change, we outlined an unprecedented, rigorous, multi-step global consensus process for the name change. Funding and governance were established with engaged 56 leading academic, clinical, and patient organizations using
what?
iterative.
Alternative.
No, it's iterative. ITERATIVE.
Okay, our genius is in the chat because I'm dyslexic. Tell me what that means.
Iterative global surveys.
Inclusive, you mean? Like they must have surveyed a lot of people across the world?
I'm gonna look that up.
Yeah, because I want also to understand that people need to understand what they're reading as well.
Iterative definition. Iterative. It's ITERATIVE. Iterative. Relating to or involving iteration, especially of a mathematical or computational process. It's denoting a grammatical rule that can be applied repeatedly. Within the syllable, the rule is iterative. Iterative.
Now that sounds interesting.
Another term for frequentative. Some languages heavily use iterative verbs. So similar is incessant, constant, unremitting, and repeated. So it just means repeating it over and over again.
Okay.
Very consistent about it. So new word of the day, people.
Because I'd rather people who don't understand. That's nothing to do with my page. Yeah. If I don't understand it, I'm going to explain it to you guys because I know out there, don't be afraid of that stigma. If you don't understand something, don't hide. It's okay to be a dummy. All right. It's okay not to know something. It is okay. All right. You can do whatever you want, but just know that if you don't understand something, we'll try to help you. You know, like this. I didn't know what that word was.
So I had to go with scientific instead of saying constant. So using constant global surveys
Right.
with responses from 14,360 people, so definitely, with
Mm-hmm.
PCOS and multidisciplinary health professionals from all world regions, modified Delphi, Delphi, Delphi methods,
Right.
nominal group technique workshops, and marketing and implementation analysis. We identified principles. Another word, prior, prioritis, prioritizing,
Huh?
prioritizing, basically.
Prioritizing. Okay, that
We'll say
works.
we got that because identifying principles, priority of scientific accuracy, so it fits. I
Mm-hmm.
mean, the root word is prioritizing. So root word, people, Latin. Uh, clarity, stigma avoidance, cultural appropriateness, and implementation feasibility. An accurate new name was prioritized over retaining the PCOS acronym or a generic name. Implementation approaches prioritized evolution rather than transformation. Preferred terms were polyendocrine, metabolic, and ovarian, reflecting the condition's multi-systems pathophysiology, and polyendocrine metabolic ovarian syndrome was the consensus new name. Accuracy was improved by omitting cysts and
Yeah,
by
because it's not
capturing,
only cis.
yeah, I had that, by capturing endocrine, metabolic, and ovarian dysfunction. A co designed global implementation strategy, including a transition period, education, and alignment with health systems and disease classifications, is underway. So it's always a test of trying to pinpoint exactly what to say because, yeah, cyst. I had a cyst.
But cis
Uh,
are different. You see what I
yeah,
mean?
they're all different.
Men,
And
yeah,
thankfully mine wasn't dangerous. So
yeah,
mine,
but they're talking about like an ovary cyst. You're talking
yeah,
about like
I try to relate back as well.
like this.
Yeah,
You're talking about this. See,
yeah. So
there
it's,
are cysts on the body because my grandmother had cystic breasts. So that's what I'm trying to say. There are things that people don't understand that they're like, oh, I know what this is. I have this. No, you don't.
mm,
And it hurts to say that because people really don't understand how much pain, how much depression, how much you're telling everybody, but I don't overeat. I'm not drinking a lot of soda. I don't feel right. I can't get up in the morning. My body feels like a dead lead weight. I can't walk. I cannot breathe. I cannot. It's because your weight goes up, it goes down, because you need to be moving to get your metabolic rate up. But if you're like me, who has to deal with situations, you can't. And that's where people are like, oh, just go exercise, go run out, go whatever. No, now I have to start from scratch because of what happened these past few years. And pray, because now I can't cosplay. Because I have to do now alternate cosplays. Because the cosplays that I had bought and had made, myself and everything, with using stuff from things and all that, ideas won't fit now. Because I gained again, because I can't get my metabolic rate to go the right way. And I just sit there like I'm looking up things right now too. I'm dealing with things, and people just keep making fun of me, thinking that they know what's going on with my life. And I'm like, no, you don't know. And when I ask people for like not sympathy, but like aren't you concerned? Aren't you understanding, especially family? Now, here's the thing. My sibling, I'm going to call it, and everything, works in ultrasound. I would love to see how they react to this, because they're probably going to tell me I don't know what I'm talking about when I live every day with it. Because I have a funny feeling that my sibling had this. That's why they gained all the weight they did after my nephew was born, and couldn't get the weight off, because they could have had this, but went a different route. All they had to do was exercise and get them right. But I don't know the whole story on that because I don't talk to my sibling. They say I talk to them, but I don't talk to my sibling. My sibling doesn't call me or anything. They just come here, yell at me, tell me they know everything, and then that's it. All right. So what I'm telling you people is this is my personal story, and I am proud that they changed the name because I am sick and tired, especially when you're dyslexic trying to say PCOS and you're saying it fast and it sounds like something else, because technically it is a piece of, get it, disease, whereas this one is more of a piss me off syndrome, as everyone is calling it, because it is pissing us off because we have said for years something is not right. Something has happened. And many people just want to either eavesdrop and hear half the story, or they think they know you and everything, or you've got family that hides everything and doesn't want to admit that maybe they don't know something. And that's why I tell people, if you do not know anything, I'm not going to fault you for it. I'm going to look at you like, did you get the whole truth? Did you find out everything? And this in the Lancet is what was published. That is now the Bible for doctors in 3 years to literally figure out how they are going to now build a bridge back to people that they told, oh, it's just a woman's thing, or you're just anxiety, or you're just a girl, you're just this and everything. Go lose some weight, That hurts. In this month of mental health awareness, think about it. How depressed would you be if you cannot get an answer for what's wrong with you? How do you think I felt when I got diagnosed with dyslexia? I didn't know what the hell was wrong with me until I read a book, Do Bananas Chew Gum? And literally when I got diagnosed and everything, But this is sad that people don't realize that how much damage they did by not listening to us saying, we know everything. No, doctors don't know everything. Nurse practitioners don't know everything. Okay. You had MP and Coxsackie disease. Do you guys know what those are? Hoof and mouth syndrome is Coxsackie, if I'm saying it right, because my dyslexia, and see, I'm going to even have the Reverend look for it. It should be either Coxsackie or called hoof and mouth. Babies get it, like thrust and everything. And MP is the other thing that we can't say because God forbid we say, what it is. It has POX at the end of it. You know which one I'm talking about? Yeah, the MP. Okay. If you look up both of those, they both have lesions on their hands, on the face and everything because of things. Now, I never caught Coxsackie or however I'm saying. Am I saying it right, Reverend? Can you find it so I can make sure I'm saying it right? It's foot and mouth from babies.
Yeah, foot and mouth disease.
Okay. I never had that as a kid because I wasn't around my baby cousins. I went to babysit my baby twin cousins who don't even acknowledge me, neither does their family, even though their grandmother raised me, their great grandmother raised me. So I'm like almost like auntie and whatever, but they don't care. Or little sister to the my cousins, but right and everything. So basically, I was babysitting them, and they don't know if it was the carpet as well because they had just shampooed the carpet, but they were crawling around, they were drooling like crazy, and I caught it in 8th grade. Had it on my feet, hands, I had the sores in, right? Because I was playing with the babies, but I never caught it because I wasn't around my sister when she was little. My sister was raised by my grandmother for 6 months. So I never was around other children who would have this. So people thought it was this, that, and everything. Then guess what? Look up perioral dermatitis. And we'll show you people pictures because we have to wait a little longer because we want to make sure, because we want to hit the hour mark because we don't know about how YouTube is with these pictures,
Oh.
You see what's on the face, right?
Yeah.
Okay. Thank you to the wearing of the masks during that panini or whatever they call it, but I'm going to call it a pandemic. I got, because we didn't realize it also is hormonal, is perioral dermatitis. But people were saying that I had MP because it was here, right? if you can see, there's part of the perioral dermatitis. See it? See it? And men get it too, from what you're seeing at the pictures, Reverend, right? So this, now, if you want to read them perioral dermatitis, because this is what I'm saying. There's so many things out there that if they just take a look at it, we can figure out everything. But I gave you 3 different types of things that people presumed. And if you don't have the knowledge of it, you could misdiagnose all 3. And the MP one is more severe than those. See, there's different types and everything. Most occurs. Now read the thing about rosacea, because I want to see this, because they gave me a cream for rosacea.
Oh, can it become rosacea? It can return after treatment. This happens even when it was successfully treated.
Yep.
Many cases that return can turn into rosacea, a skin condition that causes red pustules in the middle of your face, including on your nose.
And here's the thing, my dad is prone to rosacea. So I have the hereditary factor. But here's the thing, this is not contagious, right? It says it right there.
Mm-hmm.
What does it say? No.
No, it's no type of dermatitis is contagious. It can't be spread to another person. Thank
you. So when I would take my mask off, everyone would look at me like, what the fuck happened to you? I can say it now because we're 30 minutes in. So that's what I'm trying to tell you. If you don't have the knowledge, you can take 3 different diagnoses and they could be this, but you saw the pictures, right?
Mm-hmm.
Think about it. If you don't know what you're doing, you can misdiagnose somebody. That is why I'm saying this is my story. Oh, you're looking at what else it could be, like the lifestyles and yeah.
The symptoms causes steroids.
Oh, look at that.
Topical steroid creams, inhaled prescriptions of steroid sprays, lifestyle choices.
What is it saying? Is that what causes it?
What could cause it, yeah.
Oh,
the exact cause is determined.
It says steroids, right?
Yeah. 13 possible causes.
Okay. What was I injected with when I was younger?
Yeah.
Okay. Do you see how it relates back to everything? Because nobody thought, what are the ramifications of giving somebody this medication or anything? What are you going to cause long term?
The sad part is, besides for you with steroids, lifestyle choices, moisturizers, and heavy face creams, which
I do. No brand deal, but I have to use this. It's the only thing I can use. No brand deals. I mean, if Baby Magic wants to supply me with things, I'd be more than happy, but I can only use this because it is dermatologist recommended, hyperallergenic, vitamin enhanced, free of paraffins, dyes, and yeah, I can't use anything but this. And you know how hard it is to find this?
But to say fluorinated toothpaste, majority of toothpaste is always with fluoride. And they put fluoride in the water, which is not a good thing.
Right. And I have to have filters and everything. And this is what I keep trying to tell people, but my family thinks is that generation of like with allergies and everything. If I'm not allergic, you're not allergic. Get it? You know, all those little shorts you see on YouTube and everything of scenarios and stuff and all that. Told you people, like people don't understand like what I go through in a day. Like they're like, but you don't look like this. You don't, because I've had a lot of training. Get it? When you train yourself that you have to stay on this routine, you have to stay on everything, that's how you have to live. And I got knocked off of it because of stress from the family, stress from the job, stress of losing the job. Okay. I'm going through menopause. Maybe, I don't know, because we don't know how the steroids messed me up. We don't know how the shot from the 90s messed me up. We don't know, because that's why all of the doctors I've had over the years are trying to use me as a guinea pig researcher. But the problem is I still come across doctors who think because I also am a victim of a certain type of thing that people do to their children. I'm not going to say it here because people in my family will deny it, but people can guess what it is. It starts with an M. And when you mention that and try to explain to people the woman that's coming with you or the man or the parent that's coming with you, please do not put them near you. Like, get them away from you while you're trying to explain what's wrong with you, because they are not here 24/7, or they don't presume that you're speaking like with my ears. I'm an audio engineer. Okay. I went with my dad to an ear doctor because I cannot get whatever this is out of this ear because my insurance, they don't like. They'll see me, but allegedly. But I was saying I'm an audio engineer and I need my hearing back, right? And we don't even have brand deals for them, that commercial there. So Dad made a comment and went, yeah, yeah, right. And the doctor took it as like, oh, she's not telling the truth. The same like when I went to one of the hospitals and I told them, please, because my mother had to be, right? And I explained what happened when I was having the surgery, when I'm around my parents and everything, they took it the wrong way and stuff. So that's what I'm saying. It's like doctors will only do what they want to do. They only go by what they think they know and tell you you don't know nothing. And then when you get a good doctor, they either pass away, move, or they retire because the pandemic, So I'm left with cysts in the ears, cysts on the side of my ears, ovarian cysts, fibroids, polycystic, well, now PMOS, So what am I doing right now? I'm educating some of you because there are some of you out there that feels you've been misheard, that there's no hope for you. There is. On that date, May 12th, 2026. I mean, I don't you know what? I don't care if you guys see it. Look, can you see it? Reverend, can you see it? I don't know if you can see it a little. There's let's see if I can get it to go. Okay, this is the dermatitis, right? And then I think there might be a few hairs here, but the camera might not show it. There might be a few. But it's yeah, I think let's see. Can you see it from this side? Yeah, right there. You see those little black dots? Everything, that's them coming out. So, best bet is here, my eyebrows. It's the best way to see it. See? There's right. This is going to mess up AI. AI is going to be like, what the hell are they doing? Right? Let's see if you can see it. It's very light, but it's gotten lighter over the years, but it messes up my eyebrows too. It messes, but you see now how much redder I'm getting because I touched it?
Mm-hmm.
So that's what I'm saying, people. I don't care and stuff. But when I was acting, you had to see how hard it was to get makeup for me. I had to buy my own makeup and bring it to set. I couldn't use any of their makeup. Hairsprays, I had to be careful. All the other stuff. People were like, I said, you know how much money I have spent trying to deal with this? But to see that now they're waking up to it, at least one thing that's wrong with me, Maybe they'll wake up to the Cipro thing. Maybe they'll wake up to the steroid thing. Maybe they'll wake up to the this and everything, the dermatitis. It hurts like hell when it flares up. But it's also triggered by things. And that's what I'm saying. I'm not going to tell you what I take because what I take is not going to help somebody else because, like it said there, sometimes it is not an ovarian cyst. So what I have to take, I will say this, deals with the ovarian part of it and the androgen and basically the metabolic. See, there we go. Okay. What happened?
Some people may experience pink eye.
Oh, that's that thing I get. Yeah, my left eye. It's it's called allergy conjunctivitis. It's actually, there's 3 types of pink eye too, so you got to watch that as well. So that's what I'm saying. This all relates to everything. But when you try to tell a doctor this, they're like, you don't know what you're talking about. And I'm like, Excuse me? Like, I'm writing down everything that's happened to me, and they're still going like, but that's not textbook. I have never been textbook, and he can vouch for that. Say it's, I bet you they're looking in like, what? You know? I have never been textbook. Can't even read a textbook. I mean, I can read it. It just takes me about 3 days to understand it. So bring up more on any other things like the chart to explain polycystic ovary as well, because we're going to talk more about like these other diseases that they claim are diseases, but they're not, you know, because I love how they say these are all diseases. No, they're just your body going haywire because your hormones are all messed up, because most of this can be traced to your hormones too. Okay, here's where I'm going to tell you your checklist. All right, take off the alleged for a second. All right, how many of you had hair loss? If you have this, I have. Pelvic pain, yes. Infertility, yes. Overweight, yes. Ovarian cysts, yes. Irregular periods, yes. Fatigue, Reverend, how did I look when I looked like I was dead, right? When I'm tired with fatigue? Yeah. Acne, did you just see some of the acne on there?
Mm-hmm.
Now, mood changes does not, it's, I don't know. Do you see mood changes on me, or is it just the stress? Be honest. No, be honest.
The stress does affect us all.
Because when I'm not eating correctly, I do get moody. And that could be part of it. The high testosterone, but it's also androgen as well. So yeah, this is, if any of you have checked off all of these, you might have PCOS or now PMOS. Then again, you might also have other things. You might have history of hair loss. You might have an appendix. You know, you might have endometritis. You might be needing a diet, but I doubt it. You might have dermoid cysts like I had. You might have a history of irregular cycles in your family. Tired, you're working a high-stress job. Acne, high-stress job. Or you're a teenager. Mood changes, hello, menopause, and everything else, you know? But the testosterone could be anything. You could be going through hormone replacement therapy or changing your genders. That's another thing you got to be careful of. So, yeah. And then there's another bit of it, like the facial hair. I showed, like, you don't see as much now because I took care of it a little bit earlier, but okay. Mood changes, infertility, acne, fatigue, insulin. Now, here's the thing. We're talking about insulin resistance. Why some people with it do end up on diabetes medication. I want to find that article. There was an article that stated about it, but it has to correlate back to your metabolic. Insulin, that's the one thing about it. I'm not insulin resistant. My insulin is fine, but the thing is that I run low insulin. And the reason is they're trying to figure that out, because when I test the machines for my mom and everything, if I do, I always run like an less than like what was it, like an 8.3 or something low. I'm always low, but it doesn't affect me. The same with my anemia and stuff. So I have other factors, but there's high testosterone, which is the facial hair, the ovarian, right? Sleep problems. I'm not going to say anything about certain other ones over here, but okay. But you do get headaches. There's sometimes skin tags, skin darkening. Yeah, right here. Sometimes my skin, you've seen it, Reverend, right? My skin darkens sometimes here. I get like looks like darker freckles.
Yeah.
So yeah, that's another thing. It's like, is there any other ones you can show? Because these could also explain other things as well. Like I said, you had 3 different things. One was perioral dermatitis. One was hoof and mouth, you know, baby thrush, you know, and the other one was the MPs. They all have the same, you know. So that's why you have to talk it out, write the symptoms down and everything, because you could have something else and that could be misdiagnosed. So I'm always thinking some people who have PCOS are also misdiagnosed with other things. Vice versa. Someone who's diabetic may not be diabetic. They might have PCOS. And once they get it fixed, it's back to your normal. Your insulin's down, everything, But then again, you may have true diabetes because it's in your family. You can't say what's what until you can get an actual doctor that will listen. And lately, and put up allegedly, there are no doctors that are willing to listen, especially based on insurance. I right now have a certain insurance company that was deemed unacceptable at my doctor's office, and my doctor's office dropped me. The company allegedly called it something else, but because I don't have the recordings right now, I'm just going to say that unless you have high-end insurance, you can't see my good doctors that helped me, and that's sad because we were finally going to be able to get the scans done. We were finally able to get me everything I needed, finally, only because somebody felt that my insurance company that I picked, because that's what I can afford right now, is deemed beneath the other ones. I can go to other doctors with it, but those doctors I tried don't know my history, because I've been going to my doctor since I was 16 years old, and I'm going to be 50, people. My doctor is still there. He didn't retire yet. He just sold the practice to this company that does not want to take my insurance. And it hurts that now I have to pay out of pocket again, like I did all those years I was working at my high stress job because they screwed up my medical insurance, and then have to submit claims and everything because nobody can get it straight on anything. And then forget about social medicine. I had a friend in the UK that had a tooth infection and they made her sit for 3 months. I said, let me get a pliers and I'll pull it out, because she was shocked that I could have went right to the emergency room and had to take,
I got these for the dermatitis.
Take a legend off so they can read it.
Yeah.
Tetracycline, I'm actually allergic to. That's why it's hard to treat me and stuff. It is so hard. The only thing they could give me right now is antibiotics. And that even, you can't take a lot of them because you can destroy your own immune system.
Yeah.
I had to see what it says. Stop using moisturizers. You have to use, I have to be so careful what I use. The only thing I use is Aveeno. I use, like I said, baby products. I have to use baby products because it's that bad. But like everyone was saying, like look at this. Like that's, these actually, like if you eat these remedies, I love honey. I always have honey, Turmeric, you can find that in Goulden's mustard, Yogurt's always the best for people. You just got to make sure you get real yogurt, you know what I mean? And still be careful because sometimes they're the factory that does it, don't like oatmeal, but I do like cream of wheat, grapefruit, but you got to be careful if you're on the allergy medicine. You see what I mean? So there's a lot of things you have to like literally look into and see what can work for you. I mean, there's even things like you go look at what your grandparents did and everything, because they had to have had this back then, This is nothing new. It's also all hormonal based. Perioral dermatitis is hormonal based. Like I'm trying to find the article that says, I think it's in the Cleveland about the age, like how it's hormonal. Let's see. I'm looking up this one about PCOS. Let me get rid of that. And then perioral. We're talking about peris all tonight, huh? Like basically, where is it? Like the ages, the men get it too. Oh, I love this one. Dental fillings. I have a mercury filling that they won't remove. All right. I'm just trying to find the one where it says that it's like what's the age group for it?
Yeah, I'm going through the original one here.
Yeah. Because they say it's hormonal. It has to do with like puberty and stuff like that and everything.
The chewing gum, that really gets me.
That's because depending on if it has that certain xyla, you know what I mean, like certain chemicals in it. Okay, perioral dermatitis most commonly affects women between 16 and 45. That explains everything. It can affect all ages, including children, infants, pre-puberty, and older adults. It's categorized as a red acne rash around, and that's the National Institute for Health.gov.
Yeah, through the Cleveland Clinic, they're saying you're most at risk if you're a woman between 25 and 45.
Now and the National Health has lowered it to 16, and that makes sense. Puberty.
National. So Cleveland is still with that, but national they're expanding just to cover the bases.
Right.
Using who uses topical steroids, face creams, and more. See the causes section. However, children and men can develop it as well.
Yeah. And a lot of the guys I knew wearing the face masks developed it too. I had the dental surgery. Remember, people think I had a stroke and I didn't. I removed the cyst. That's what I'm saying. I'm prone to cysts. And I had the stitches, everything and stuff. So we don't know if that even aggravated it. You know, we're lucky I can still, but my smile's not the same from my headshots or anything. You know, they can move the skin up a little bit, but do I want them? Like, I already found out I might have to have plastic surgery because my deviated septum, because I got hit with a softball here and everything, messed up my nose and stuff. So it's up to me if I want it done. And it took this long for them to figure out. It took this long. But the problem is insurance, depending on where you go, what doctor you get, and if they're going to listen to you. And put allegedly up. Remember.
Allegedly.
And my little logo is missing.
Because of the picture. Yeah. So I had to.
Okay. Because what other pictures do we have in there, like with everything? Because it's just sad that it took this long for them to rename everything, but to show people that it could be multiple things, you know?
Besides the redness on people's faces.
And then polycystic ovary with everything, you know, because this show really was about the triumph that we got over polycystic ovary, but those were actually scenarios of like why you need to hound your doctor, because if you're diabetic, have them check for polycystic ovary. If you're infertile, have them check for it. Nope, have them check it. You know, you never know, because other things could be other things. We're on at the wrong time because there's nobody on here, you know.
Well, they'll be watching it later.
Yeah.
There's so many tabs up. I can't remember where am I?
I know you got all the stuff because of everything. I'm sitting here trying to pull up my stuff, but I don't have the function to share screen or anything because you're in the actual studio.
I've been looking at what we last saw here, and the redness in the faces, and the.
But no, go back to polycystic ovary. What we're talking about, you know.
Okay, that's on the other window.
Yeah, because that's what the main topic of the show was. Because I have to live with all of this.
Polycystic ovary.
Well, I have to live with the Cipro problem. I have to live with the polycystic ovary. Well, now PMOS. I have to live with the perioral dermatitis. I have to live with I even have costochondritis. I'm a walking medical book, as my dad puts it. I said no because they don't want to follow the textbook. That's why, because being on the medication of naproxen for my knee, we missed the diagnosis for the costochondritis. Because I couldn't understand why I couldn't run a lot as a kid. They thought I had asthma. They thought I had whatever and stuff. I thought I had baby asthma. Like my nephew had baby asthma. Nope. It was costochondritis. It was swelling the cartilage in my lungs. So think of it this way. Having costochondritis, metabolic ovary syndrome, right? All the other stuff wrong, because now I'm gaining weight, causing more swelling on the cartilage. I'm lucky I'm able to breathe.
Let me try this here.
He's trying everything.
Because a lot of this stuff won't let me save it, so I'm just gonna do share screen instead. Let's see.
Ooh. And it's hot as hell here, guys, because here in New York, it is 86 degrees and it's getting hotter. And I just took a shower. I'm like, yeah, I just took a shower. And now I'm sweating. I'm spritzing. Or what is it? Whatever it says in Yiddish.
I knew it was gonna be Yiddish, and I can't remember anymore. It was because of the Three Stooges. They're all Jewish.
Yeah, but then we also got to remember we got Spaceballs 2 coming out, so we got to brush up on our Yiddish.
And when Larry said basically drop dead in Yiddish, I can't remember the words exactly. I used to say it all the time.
They curse in Yiddish. Yeah, you just saw the smile there. Like, I can't smile on this side for anything.
I got this one here.
This is in Australia. What is that? Austria?
Australia. Australia. Yeah.
Now, here's the difference. Let's see. What does it say there? Your GP looks at the full picture, not just the symptom or test.
Yeah, your GP will ask about your period symptoms, TTC journey, and any changes over time. Number 2, the blood tests may check androgens, thyroid, prolactin, glucose, and HbA1c to look for underlying factors. Third one is ultrasound, and ultrasound may be used in some adults, but results are not used alone to diagnose PMOS. And then the GP review of your GP brings together your symptoms, test results, and history to understand your unique picture.
And that's what the nutritionist did and everything, to the point where I know what I have to do. But when you're met with people that will not help you, that's a problem, because they think they know what is how it has to be. If you could say to them, this is what I need in the house, this is what I can only eat, this is what I can only have, why do they fight you on it? Why do they steal it from you? You know, allegedly. Why do they tell you you can't? Like, I used to eat 10 bags of oranges a week. And oranges are check if with the correlation with oranges and polymetabolic syndrome. Like, bleh. Thank you, dyslexia.
Close this one, so I can go back to. I don't need that anymore. We talked about that.
Yeah.
And stop sharing this. Let me go back to.
Like, if you look at oranges and like fruits, vegetables, things like that, we forgot how to eat naturally. We always are pumping things with chemicals, like bioengineered foods and everything. And why, yes, it may help some people. People like me can't have that. And I'm trying to explain to people that I need to grow my own vegetables. I need to do this. But some people are like, oh, we don't want now. It makes it, you have to make it bad for everybody else. No, I don't. Because my injuries will be on your hands, because a lot of people don't realize that the first rule of medicals and even witchcraft, do not cause harm. Don't cause harm, if I'm right, and everything on the part about medical. Let's see.
PMOS diet, what to eat and avoid, through The Well by Norwell.
Okay, that might be hypothetical. Like, it's not a medical journal, right?
thewell.norwell.edu, women's health.
Okay, it's an EDU, which means it might be a study.
Education.
Okay, so it's probably a study. Is it valid study? Because, like I said, it's got an EDU, but do you think it has any published reports or anything, or no?
Let's copy it and bring it to.
Because we can literally, that's what I'm saying, we can literally just look at it and use it as an example, but we're not sticking to that example because, like I said, everybody's different. Like I said, I need it tailored for the ovarian, See, the Well, I don't know. They are educational, but they're not. You know what I mean?
It says she is an OBGYN.
I know, but it's like depending on which doctor perceives it. You know what I mean? That's the problem we have. Like, we would have to look up what type of doctor she is and everything and her credentials and stuff like that. But if you scroll down, what is she saying? Because I want to see if hers matches my nutritionist. Okay, what does it say about the diet starts? Because I want to see what she's saying. Because these GLP-1 medicines, I can't use those, and I refuse to use those. Because I don't want to be having to be pumped with chemicals. Because I've already seen what it can cause on other people that are taking GLP-1s who are not realizing the side effects.
What to prioritize on a PMOS diet? Plant-based and lean protein. Think tofu.
Now, here's the thing. If tofu, some women can't have it. I can't because of the ovarian cysts.
But
plant-based.
Fish, Greek yogurt, chicken, turkey, besides tempeh, lentils, and quinoa beans.
It's a small little one. I have it next door. Okay, so here's what I'm going to show you on this. Besides the fish, my normal food when I was younger was the plant-based foods, because I would always have a salad at my grandmother's. It was always lean turkey. It was chicken. It was chicken legs. You know, it was normal every day. Like, but I can't do fish. I would have the yogurts. I would have everything, sunflower seeds, you know, stuff like that. And then avocados. I always had the vegetable sushi, which was avocado, carrot, and cucumber. Okay, olive oil, Italian. Hello, I'm Italian. You know, all that stuff. You know, that's what I'm saying. Like,
the broccolis, the greens, the zucchini, cauliflower, peppers. Peppers.
Yep. So that's
what to avoid.
See, confirmation cough.
Yeah, to avoid the normal things of refined sugars. You know,
after I'm drinking this, right?
The high processed food, carbs, the alcohol, just in general.
Right, but I have this in moderation. But the problem is society doesn't allow you to eat normally. So you have to figure out how to do it. And when you're trying to explain to people, they just look at you like you got 3 heads. You have your own situation there too. Yes, people, I am so sorry right now. We're having technical difficulties because we also have human lives to deal with. And we have things in our life that the alleged system does not understand, that we are not robots, right? We are not
Transformers.
We are not the letter A and the I, you know. We are just people who are trying to deal with the way society has deemed us, you know, because you guys wanted the easy way out. And now, because of the easy way out and all the other things, we are now backtracking everything and finding out that, oops, this did not work. The experiment failed, which is why now we are grateful for this, because now a new experiment will start. And hopefully what I've been doing, you know, will be recognized, because I'll sit there and tell people what I do. And they're like, maybe I should try that. Maybe I should do this. You know, I tried to save a friend's life because a doctor gave them 2 generic medications of the same medication under 2 different names. And how do I get treated? I'm told I'm a bad friend. You know, hasn't spoken to me in a year. Well, soon to be a year. You know, because I'm trying to keep them safe, because other people did not realize what they were doing was hurting, you know. And that's the thing. If you have good friends and they're willing to fight this with you, they'll be able to keep you on track. If you have fight with doctors, yell at doctors, scream at doctors if you have to. And this is the doctor that's talking about this, right?
Mm-hmm.
I would research her, people, and see how she is and everything, because it's not only gynecological, it's metabolical, it is mental, it is, especially with Mental Health Awareness Month. Do you know how much stress and anxiety people are under with this? Because nobody is listening. I mean, do you see anything else updated on like foods and medications? Like look up herbal medicines, like herbal supplements, right?
Mm-hmm.
Okay. Because now they're promoting that. Now they're going to study the GLP-1s with PMOS. And I'm like, don't you dare. I've already seen what happens with people. Yes, some people can take it, but I want more research done on it. That's my thing. I want more research done.
Herbal supplements for PMOS.
Because I want to see the ingredients, not hide the. See, that's the thing about people and these things. Tell me the ingredients. Tell me what's in there. Don't hide things from me. You want me to trust the medical advice? Don't hide anything. If you have to hide the ingredients, say I should not know, then I'm not taking it. Because there was one time they wanted to give me, because meningitis had broke out at the campus when I was at school, not the second college, but the first college. And I was like, I'm not taking this. Lucky I didn't. Okay, let's see what they say, and I'll see if I'm taking some of them. Again, the well. So we're not promoting the well, but this is the thing that the internet is stating. Oh, I forgot, people. Don't show your fingers to the camera because AI can take your fingerprints.
Yeah.
I forgot. I'm so used to.
I forgot that too. Don't do the peace sign.
No more peace signs, no more anything, because AI can get your fingerprints.
Yeah. Show the back of your hand.
Yeah. Even you got to be careful with the back of your hands too. You might have 10 fingers, but maybe show 11 later. Like right now, I'm sweating and it's aggravating everything, you know? What do they say about some of the supplements? Like, what are they showing?
When you search PMOS supplements, you get millions of results and more opinions than answers. TikTok says, try.
Oh, no. We do not condone TikTok.
Yeah.
This is another thing I will say. You guys may love TikTok. I don't. Okay.
And another swears spearmint tea. And then there's this one says this says it, but it's enough to make you close all your tabs and walk away. Some supplements can help, says Dr. Stephanie McNally.
Yep.
She comes about it again. But they work best as part of a plan that supports your metabolic health, not a replacement for food, medication, or medical care.
Here, so, I'm going to send you this. Okay. Let me send. It's on. I'm going to send you the Google link to the page. It's right on the first page. But I'm also going to paste and click into the thing if it'll let me. All right. Let me send it to you in private chat. See if you can pull that up. If you can pull that up. I don't know if it'll let you. Because otherwise, just put it in as this. Because the computers are still catching up.
Yeah, for the...
Yeah, try that. Just write that in the search bar.
I did. I popped it in there. It gives me an AI overview.
It's the thing I want to warn you guys.
Through
the
Google.
AI overview is
Google.
not a true AI overview, but because Google allegedly wants to use AI, it is mixing things. Why? You're going to take this with a grain of salt, but it says it's targeting hormonal balance and insulin-resistant inflammation, right? You see the list that's there, hormone balance and ovulation?
Let me switch over to that link you gave me. Let's see here.
Because I'm talking about, see if you can get into it. If not, because I want you to see the stages of it and what they treat. The nutritionist will do, or the Chinese herbalist. Okay, see here? First, they start with the hormonal balance and the ovulation. I fall in that category because of the ovarian cysts, the dermoid cysts, the fibroids, and everything, right? We know it's hormonal, but I have the double whammy. right? Now, if you can read it the way I can see it, I'm hoping you have the same one, right?
Yeah, because the Vitex, the chaste tree berry, the spearmint, the
Spearmint
salpimento.
is actually for the hair. The hair. It's the hair. It's called Hirschim. HIRST. Like, if where's Google Talk? Google Speak usually tells it. Copy. Where's Google Translate? That's another thing with my dyslexia. I use Google Translate to actually tell me words. English to English. So I look for English so I can say this word because I cannot pronounce it. I want English to English. Okay, you're gonna be evil on me, right? Yeah, gonna be evil. Okay. Paste. And hirsutism. It's the excessive growth of facial hair and not fun.
Oh yeah, hirsutism.
Yeah, it tells you right there. Studies that lowers the levels of which is excessive hair growth because of the androgen levels. Okay. Saw palmo, black cohosh, macaroot. The only one out of that list I can deal with right now is spearmint. I can't have the other stuff. Okay. So they try to find me stuff that matches those. Okay. I will tell you that. If it's on here, I will tell you it. If it's not on here, I'm not telling you. Okay. Because I want you to check for yourself. Now, when you go down to metabolic and insulin, here's where the metabolic part is. This is why they're saying berberine, licorice root, fungi. Right? I can't have cinnamon. I'm allergic to cinnamon. That is another problem. So I can have these three. I've had licorice root. I've had berberine. I've had this. Not bad, right? Now, stress and inflammation. Now, this goes for anybody. It is the ashwagandha, the turmeric, and the holy basil. But that's for stress and inflammation. And then additional, look at that. Green tea, nettle root. I love nettle root green tea. Okay. You can find these teas in local like Asian stores or apothecaries and stuff. Some people grow their own. These are just samples. All right. And then here, like even here, if you look at the bottom, it says how's Koreans treat, because guess what? Some Asian cultures are prone to this because of the famine that had happened over time and stuff. Like if you go back into history, you can find out where this started and how it started, because a lot of times during famines and everything, the androgen level would build up because they needed a way to survive, extra, and look that up because they do have a study on that on Asian history and PCOS because of culture and area where the high concentrations of PCOS are. There's even like what herbs balance hormones, everything. This is something that's for people who cannot take chemical medication. It's a step in the direction. You go to a nutritionist and they figure it out. Go to a Chinese herbalist. Like, you got to remember, what did they do back in BC? What did they do back in early AD? They didn't have the local drugstore. They had the apothecary, medicinal plants, and things like that. So if more people are going to it's a Western tradition now, there might be a reason, because Eastern doesn't want to listen, and maybe now they'll listen because they have 3 years to figure out the mistakes they made. But will I trust? I don't know. To be told about my family, you eat too much or you drink too much soda, go out and walk. A lot of people think that when you talk about this, they have it. Those are some people like that. Or they're like, you're copying me, you're doing it. No. The reason I don't look like I'm sick is because I have to deal with another situation. Okay? Because I really have no help. Immediate meaning. I have outside help, but I don't have immediate help. There are people that do help immediately, but they know the routine because of what my situation is. And right now, my situation is I am highly stressed out, not being able to find work. Let's take this off the screen.
Okay.
Yeah. Because all this is playing a factor into my health right now, my mental health and everything, because I had to be taken off my medications. I got highly stressed at my job because of what they were doing. I had to deal with situations here at home that are highly stressed. I am not able to find work because people are looking at my disability, my age, and my physical disabilities. I want to go have fun so I can bring down my stress level, my cortisol, and and stuff like that, my androgen and stuff, but can't do that because there's no money to do these things. There's no, right? To have someone say your GoFundMe is fake because you literally are out of work and your bills are piling up because somehow life hit you a curveball and you missed it, So, like, what do you do? And it's sad when people think they know everything about you and they don't, even your doctors. Because in my doctor's office, when I started out, I had one doctor who would take care of me. Then I had two doctors that would take care of me when I got older, because you're at that age being a girl. So the one doctor was taking care of the knee while the other doctor was taking care of the ovarian stuff, right? And the female problems, as some doctors call it. Then you get everything else. Then it piles on. And then you find out that now is not even a doctor seeing you. It's a nurse practitioner because the doctor is too busy to see you. I don't want that. I want a doctor seeing me, because maybe the nurse practitioner doesn't understand something and mixes up three different types of diagnosis, thinking it's one diagnosis, probably missing the most severe one. And I've proven that by showing you three different things that could be the same thing. Technically four if you count rosacea. So what do you do? Well, for me right now, I have to try to get back on a routine to eat. And it doesn't help that I am highly stressed right now, which I need to understand, my apartment is being fixed. There's no stove or anything like that because we're trying to take the kitchen little by little and everything. And I refuse to let them fix anything in the summer. Like, they can come fix it, but there's no air conditioning in here either, because my situation is I'm next door helping with things, or I was working all the time. So I didn't need an air conditioner in here. I didn't need to really use my stove. But now that I need things, people are dismissing me, saying, oh, you have this, you have that. No. The GoFundMe was started because my family can't keep helping. We thought I was going to be out of work for 3 months, not a whole year, almost a year and a half. We did not know what was going on with the world and everything. So, yes, it's stressing me out. I'm getting puffy again. And people are just telling me, oh, you overeat, you do whatever. No. You know what my routine is? When I was doing things, it was, believe it or not, nothing for breakfast, because I had to get my metabolism to start. So that's why when I walked to work, it was triggering my metabolism. Then I would have a light lunch, what I could afford, because they only gave me a half hour. And on a half hour, you can't go to the stores. There was no anything. So I always had to bring my lunch and pray it wasn't tampered with, allegedly, especially when a judge finds it and everything tampered with. Then I would, after work, that's when I would have my bigger meals and actually have my food, my salads and everything and stuff like that, because I would walk back from the job and I would go to the deli and get garden salad, light dressings and stuff like, and stuff like that, until I started walking to work and they were giving out the free food at the truck and everything. And that would be my lunch at work, or the schools would be giving out the leftover sandwiches for lunch, or the food that would go bad, and stuff like that. And I was getting better, Then at the same time, I have my routine of what I have to take. I am on actually 2, 4, 5, 7 herbal supplements. 7 herbal supplements. Legal. Okay? We don't play that game, So I have to take those and a Tylenol because of the pain in my knee, because I had to be weaned off of the naproxen, because I was also diagnosed with ulcers because of the situation at home. And it didn't help that the naproxen being at 2,000 milligrams twice a day, they're surprised I have a stomach left, because I have ulcers as well. So yeah. So the medicines was actually healing my esophagus. Okay. Because of what was going on over the years too with that, because of the acid reflux from the ulcers. Okay. I was doing better until everything hit back in 2024, 25. And I just looked at people like, how could you do this to me? I asked for help and you dismissed me. You thought I was a bad person? Well, look, you got the same problems. I'm gone, you know? You got the same effing problems. So what does that leave me now? Well, I was stressed out for a whole year, felt depressed, but the depression was caused by people. My doctor even said that we don't need to put you on anti-anxiety medicines. What you have is polycystic ovary syndrome, and we got to try to keep you trackable. I tried taking my medicines. That didn't work because we had another serious situation happen next door that my mother blames me for. But when you don't take care of yourself like you're supposed to, yeah, you know. But I'll be telling you this, guys, I'm not blamed for the pacemaker. That's something else. Okay? That's her thing. I am not blamed for that. Please do not blame me for it or anything. She might have told some of the cousins she has it, but or my sister, sibling. I keep forgetting that since it doesn't like what I do and feels that what I do for a living is not what they would like. They are just a sibling, you know? And it feels later, Rev, doesn't it? Look what time it is. It feels later. It's not even. Usually we're on this thing until... And you're muted.
With the time change. Yeah.
And I've got a message coming in. That's weird. Let's see who's trying to bash me right now. Oh, my cousin is having a situation to himself too. Oh, Christian just posted something.
Oh yeah, it's for next week's episode.
Yeah. But he's also, Hoovian cosplayers, we want to hear from you, whether you have been... Okay. Okay, that's interesting. We'll let Christian, unless you want to post it for Christian on here, because we appreciate Christian for letting us use the studio. You know, so anytime he's promoting anything, we will promote it for him. And you're going to upload those while I continue talking about like everything, you know? So, like I'm saying, stress is a key factor in polycystic ovary syndrome, or now PMOS. And I'm not going to try to say it again. Okay? What do we do about it? Well, ladies, some gentlemen, because if you're transitioning, we don't know yet. If you're fully transitioned yet, you might have experienced this while you're transitioning, or you might have had this before you were transitioning, because it's not, you know what I mean? Please talk to your doctors. Okay? Because I'd like to see the case study that if you're transitioning, does this go away? Because that would be interesting. Because think about it. If they're now increasing the androgen levels in female to male, right? Would this now be gone? Do you see what I mean? And would somebody going from male to female end up with this because it's the metabolic and you're changing the metabolism of both the male to female and the female to male? because the key factor is the extra androgen in the body. Get it? It's the extra, like, steroids. You know what I mean? It's the extra, the things that are causing the stress, causing the higher cortisols, the higher whatever. So that's going to be an interesting study if they actually correlate that. And I'm patenting it right now if they want to pay me for the study. Because that's where my dyslexic brain goes. It's like, okay, now you discovered it's the metabolic rate, right? But then you also have people who are transitioning. Now, is this going to affect them if they have this or cause it? That's how my brain looks at this. Because it causes infertility. Okay, it causes, but will the transitioning correct or give, depending on which way you go? If your family has a history of this. For me, I want to get back to my spearmint teas. I want to get back to my food that I eat. I want to lose this weight so I can fit in my lovely cosplays that I actually had fitted to me when I was creating them with a little bit of extra room, because I thought in case anything happens, like when you get your cycle, you get swollen, bloated and everything, right? So I always do that. I always buy extra, like bigger, because of that. And I put my own design in so I can open up the seams and everything and stuff like that. But it's a good topic to bring up, and it is hot as hell in here, and it's 1 minute to 11. So, do you think I should pick one? I have 3 bags for our people while you're getting Christian's thing ready. So we have this bag, which is a very big, I don't know what's in it bag. Well, I do know, but technically, and the computer is like playing with me. I have this bag, which was from a convention, and this bag from a convention, which is falling apart, but I have this one. We can see what's falling out of there.
The one that's falling apart, because that's why you can use
this stuff.
Take it out and box it up later properly. Yeah.
This one.
Yeah.
Like these look nicer, right? Okay. So.
Or like close out these other windows.
Yeah, you close out that. Like, I love how this is live, people. This is why I love messing with AI. The algorithm messes AI up so bad because they don't know what I'm going to do next. And I have to put this here. I have to put this here. Because this is supposed to be here. That's supposed to be there. Like, everything is falling. There we go. This is live, people. This is live. Politeness and normalcy went out the window years ago. Okay. So this might be a mixture of things from things people have given me over the years, right? I have to say, I love this company because they were going to work on something for dyslexics. MSI. If you know the computer company MSI, they were going, when I talked to them about operating systems and everything, dealing with dyslexia and everything, they said to me, oh, okay, and stuff. So this is a mouse pad they gave me, but I don't want to take it out. It might be just a plain mouse, but it's a plain one, right? So they gave me a mouse pad, all right? And I think I have some other MS from them. I'll show you what these things are in a second. I think my friend gave me that from the library. Yeah, I have more stuff they gave me. They gave me a dragon puppet. I can't. That's why I said I can't use him as my mascot. Sorry, guys, but I got a dragon. Hold on. Let's see if I can do this. Oh, good. Okay, hold on. Let's see. We need this. No, we need this and this one. This is it. That's the fingers. There we go. It's hard to do because of everything, but So it's got instructions too, but they're in Korean. I think they were Japanese. So yeah. So I've got that. Did they give me this? This was another company. This was Workstation. This is from another company. This was I think a USB connector or for, and then AMDA gave me a micro version of their, this was all from the Build Expo with BME down in the city and stuff. What was it? Oh God. B&H services. They gave me a ice cube tray from MSI of the Dragon. What else did I get? They gave me cleaning cloths from other places. More AMDA things. I think you can have one, Reverend. I know that. And then I said I needed a frog because of things, because the other company was giving out a frog. So I needed that for my Mau. So I got a frog from Eaton.
Lucky.
And then someone gave me a camera lens thing.
Ooh.
And then there's a lot more fun stuff in here. They even gave out Tide sticks, you know.
Yeah.
They gave out pens.
Always with pens.
And they gave out this, which is color changing fidget spin things from I forgot the name of this company, and my friend Jeffrey is on my Instagram, and he's gonna kill me because I forgot the name of the company. Let's see what else is in here. There's like all this other stuff. Yeah, it's all. Oh, and then MSN gave out these that if you took your picture and put it on, you could have won a prize. And what else was in here? I've got more of these little keycappy things. I gave out a lot of them during Halloween. That, and let's see, because everybody, like, when you tell me we got the kids, and then Nikon was giving out hats. That's why, and it was free. B&H was doing this for free. It's a build expo, and you get to meet all the tech people, like build your own computers and stuff. But the problem was a lot of it, like Logitech was there. I told them how it doesn't like with the Microsoft and the new computers with HP and stuff, you're losing the Logitech functions. It was HP was overpowering it. So they were trying. And I also met somebody who was an actual doctor who loves Doctor Who. And she's like and she's a she, by the way, you know, and all that. But this one, I think, was this a shirt they gave me, or this was somebody gave me this? Teflon filters. I think somebody gave me that one. You know, so I get T-shirts that I can use for like night shirts, painting. I think my friend gave me this one. He was at the library. Yeah, I think he gave me this one. Wait, before I show it, let me read what it says. I think somebody on TARDIS might be mad. I think, yeah, it's from Logos Direct, powered by Logos Direct. Yeah, we know somebody that's going to want to take this from me, isn't there?
Well, too bad, so sad.
Sorry, it'll be my night shirt. So that's what's in this bag. It's all little tchotchkes, the dragon. I mean, I know the Reverend's going to probably want a little keycap. I mean, this is, you want to laugh? This is what it looks like, because this is mine that I took out. That's what that looks like.
See what?
That's my keychain thing. I took that out. I was going to plan on using it for work, and then it was like, nope, I didn't have a job. I actually went to see if I could find a job. And I saw things that, well, I told them, I said, you guys don't make things correctly for dyslexics. I can't use the stuff anymore. So let's see what happens. But I do want to deal with this company if I can, MSI. I was supposed to get in touch with them, see if we could build something, but I didn't know I was not going to find a job for a whole year. And I was supposed to go to the B&H one this year, but I didn't get a chance to go because, look at me. I couldn't even fit in my clothes. And there's this one press guy that thinks that he's all that and everything. He's one of those that got mad at me because I got a press pass and he didn't 1 year. And he was my friend. So, you know what I mean? But he's friends with somebody that I work with on production stuff and everything. So I have to play nice. And the lights are going off in the bag. Look at this. Look at it. The lights are going off. Come on. Where are you? Which one is it? Which one is it? It's this one. It has to be the temperamental one, right? Yeah, that one. So yeah, I gave out a ton of them for Halloween. I only had a few left, and Jeffrey gonna kill me for not saying the company right with the one with the lion on it, because I wanted them to build my anime computer. Because for me right now, you guys, this is all just me trying to get ready for everything. because I have everything all over the place right now, and this is not supposed to be there. All right, so that's going to get packed up later. And hopefully tomorrow the heat wave breaks. But see, guys, when it's too hot, that's the perioral dermatitis. It's not contagious. You can't catch it. And if you think you can, then you didn't do your homework. So your assignment is this. Ask questions, no matter how many people think you're annoying. It can save your life. If I wasn't as annoying as I am, I don't care. Because after being so annoying to find out that now I was right and my nutritionist was right and everybody was saying, oh, no, you don't know what you're talking about. Guess what? That's why I was a lot thinner months ago and wasn't highly stressed out or anything. Yes, I had to go get waxed every 5 friggin' times because of things, like especially going to conventions. Oh boy, it's going to be fun, you know? But I have to figure out how to lose weight, how to whatever at this point. So, and it's not going to be fun because I have to start my routine back up again and I have to stay on track. It's okay to miss a day, but I just got to make sure I stay on track. Otherwise, I am not going to lose this weight and I'm going to be in more pain because the extra weight puts extra strain on me and people are going to think I need insulin and all the other stuff. And I'm like, no, we know what to do. It's just that I don't have I don't have what I need because looking for work, my bank account's drained. But you have people that think when someone tries to give you a helping hand, that you think, oh, you can get money from the podcast. No, we don't get money from podcasts. We get no brand deals. Look at how much stuff. I'm like, guys, I love Coca-Cola, especially now that we have the FIFA World Cup coming. You know, I can only use Baby Magic. I'm like, what else have we got here? I got Disney stuff. I got My Hero Academia stuff. I love going to the Boo at the Zoo. I mean, I've got anime. I got whatever, right? But I'm not buying any of it right now because I don't have any friggin', you know? So if someone gives me a gift and someone says, oh, why do you have that? Because someone was being nice, you know? And someone was being nice, making me a GoFundMe. And someone told everybody it was fake. That's not right. What does that say about your character? The same thing about, like I said, 3 different illnesses, 3 different things. One is severely contagious. One is mildly contagious, and the other is not contagious. But you all think you know everything. So what do you do? This is not contagious. I am heavy not from drinking 24, 50 million cans of soda. No. I have now Polyendocrine Metabolic Ovarian Syndrome, which, like I said, trying to explain that to people who think they know everything is a losing battle, especially if they're a narcissist. So, what do I do going forward? Well, I'm going to, like I said, try my best because it is now 11 o'clock at night and it is too late to eat normally. I'm going to try to have my fridge full of things that are pre-made meals until I can get my kitchen back in order. Because if I'm going to be in here fixing my apartment, I can't stop to go, you know what I mean? Because once I leave you guys, I'm going to be on the computer after I go next door to help my family, try to look for work till 4 a.m, then try to get some sleep, which is another thing that's bad, you know? And then by the time I get up, I have to come back in here in the hot weather with no air conditioner to try and fix everything that I did not create the mess of. All because everyone thought they knew what was best for me, because if it was their life, this is what they would do. Well, newsflash, people, and according to those who also think they know my life, this is my life. It's messed up, effed up, and straight up to the point where if one more person doesn't ask me what's going on correctly and believes the other people around me in my family and everything, because, like I said, I don't talk to my sister. I don't talk to my sibling. Okay. I have to learn that new word. Okay. My parents, dad was always working. Mom was mad I wasn't a carbon copy of her. Because according to her, I should not have allergies. because she doesn't have them. Right now, I'm the bad daughter because I am trying to be lazy and not look for work and everything, that I'm just mooching off of them. No, I'm not mooching off. It's only been recently that I need help. I was doing fine. I thought I was going to have a job within 3 months, maybe 6 months, but welcome to the world where there are more layoffs than jobs, and you guys still won't admit why. But that's okay. It'll eventually backfire on you. It will eventually whatever, because you're going to see later on, just like this, that all those people that kept saying no, 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 now have to eat crow. They now have to apologize to every woman out there who had polycystic ovaries and were told that we were just delusional, anxiety-ridden, go lose some weight, you eat too much, to only find out that now they have 3 years to make it up to us. I doubt it. But that's my story. Right, Reverend? And you were not offended by any of this? It didn't gross you out or anything? Because if I really went off on what I go through in a day, YouTube might not like it. Because it would have to be put up graphic content. Because we didn't have any graphic content for you today. You notice that? And we didn't have any trolls today. Do we have any more? Let's see. Do we have? Nope, we don't have any trolls. So that's what I'm saying. And we had a really cool, like, you're mad you want those key codes, right? Those little. I told you I have things for you. Like, people don't realize when I go to these things, I have things for everybody, because when I sit and talk with everybody, they want their stuff out there. So what's the best way to do it? Happy Halloween or people I know. It's not only word of mouth. It's like you make those little tchotchke things. People are going to see them and like, oh yeah, my friend works for this company, blah, blah, blah. Here, have take it. I got an extra one at home, just make sure you have one for yourself, but no, because they don't want to take it home. Like when you go to the conventions, I tell the vendors, allegedly, because put the allegedly up. There may or may not be free books in the dumpster. There may or not be free books on the floor. There may not be, because some people's boots, they will either make it very discounted or tell you, take it. I don't want to take it home, because they're sample things. You don't realize when you go to conventions, they're not the full product. They're the sample products in the full size bottles and things. So I'm telling you right now this. Do your homework. Question everything. And if someone keeps dismissing you when you know your truth and everybody else knows, that means they don't care. They want it because you're taking away the limelight from them. Or you caught them in something, And I've caught a lot of doctors out there that have lied to my face. Like I said, I'm still dealing with an ear infection right now that I'm healing myself, because I showed what happened with my ear to my friend, and she said, and showed the doctors where she works, that they said, you have a cyst in your ear. I said, yeah. They go, and you did that yourself? I said, no, I did it because a doctor showed me how to do it during the pandemic, because when you don't have insurance, they were not going to see you unless you got a certain thing. So I had a very good doctor who had been treating me for years give me things to take care of it, because I would be on set or I would be somewhere, because this is over 20 years of dealing with cysts in my ears, that I would have to take care of it and fix it. I've got one on the outside. I have what you see here, I had over here as a kid. I'm prone to things. But people are like, oh, you're copying me. Oh, that doesn't happen to normal people or anything. Nobody's effing normal. I know multiple people who have polycystic ovary syndrome, which is now PMOS. Okay? I am like, when I hear somebody has it, I want to hug them. Because I'm like, what did your doctor tell you? What did your doctor tell you? I want to start a little group chat. Like, what did your doctor say to you? Did they tell you were just fat and stupid? Or did they tell you that you just you're just too overwhelmed, or you're just preaching or whatever? You know what I mean? Or when you told them that you can't have kids, like you're like, why can't I have kids? Why can't I have kids? And then you find out, oh, your ovaries are so full of cysts and everything because you have that one form of it. Just like other illnesses, there's different forms of it. that you have to have a wedge surgery to take a quarter wedge out of your right ovary. So your right ovary is smaller than your left. And when you go to have another scan, you get a ultrasound tech that doesn't know what they're doing. And you explain to them, I had this. They're saying, oh, there's a cyst on the left one when there isn't, because the left one is the right size, but the right one is smaller because they took the original dermoid cyst out of it. And were able to save it because the doctor who passed away knew what he was doing. Granted, they wouldn't let me keep the damn thing they got out because they got it intact. And when I wanted the damn monster. You know what a dermoid cyst is, right?
I don't know. I had to.
No. A dermoid cyst is either it can give you an extra finger, anything. Sometimes when you have it on your ovary, you can get hair, skin, teeth, and everything. No bone structure.
I got enough to collect. I already have
a monster growing.
I still have a couple of kidney stones. No, I have one kidney stone somewhere.
Yeah, but no. This is it can replicate like an extra finger somewhere. It can whatever. Yeah, look up dermoids. Next time we'll talk about dermoids. But I don't think YouTube would like it because we're not medical doctors. And if we show a picture, some people might get scared because they think it might be the munchies or the other horror pictures that we have been seeing, because sometimes there's teeth and hair. Might have been an eye. I don't know. They wouldn't let me take it home because it was intact. That was the first one that they got intact. That's why they could save the ovary. And it's somewhere in Lawrence Hospital here in New York. I don't know if it's in the pathology lab, but I wanted to see it. And they were like, no, you did not want to see it. And I'm like, why? Everybody else gets to take their tonsils home in a jar and everything and stuff. You know, when we were kids, you take your tonsils home in a jar and stuff. Who knew back then, right? My grandparents took their tonsils home. I mean, I have all 4 of my wisdom teeth sitting in my medicine cabinet.
Yeah, mine are.
Yours are still, yeah.
Mine were taken out and they were,
Oh no, mine are sitting in gauze in the medicine cabinet because one looks like a hook, like a push pin. It's not 4. It's actually 1. I told you I'm not.
You took out 4 teeth, took out the wisdom teeth, lost a tooth. Those cut off.
I have mercury filled and everything, because the reason they think my teeth were like that is because I also had drank the water because we had family. We visited, well, we called them family, but they were friends, where the thing that in Jersey with the toxic situation in Jersey, Tom's River toxic situation. I grew up over there. And the Long Island situation with the well water, why I cannot have well water. And I know I'm doing that because I forgot about the AI program, but I'm trying to do it as fast as I can so they cannot get my fingertips and everything. Because I also, AI will have a problem with my fingertips because I actually changed my thumbprint. They tell you can't change your thumbprint. Well, guess what? I told you I'm not textbook. I changed my thumbprint. And when I go get my fingerprints done for jobs and everything, they think they made a mistake. And I'm like, no, that's actually, they said, but you can't change. The detective is looking at my hands and like, what the hell did you do? Because no matter how many injuries you get, you cannot alter your fingerprints. So I have to sign a disclosure waiver thing that tells them, yes, this is a childhood injury. Don't ever play with door jambs. You know, when you close a door and you see the metal piece, and yeah, don't do that when you're little. Because your parents, when the children were disappearing in New York City during the 80s, and they had to do the child watch and everything and stuff, you had to get your fingerprints redone at 6 years old because, yeah. Or was I 5? 5 or 6, because they had just done the fingerprints and I had to get them redone. Yeah. I told you it's going to be a fun ride on here. And I do have a lot of people that want to be on here, but we have to figure out time frames and scheduling. Because in 100-degree weather, I don't think we're going to be on here. You're going to be seeing me in a t-shirt, tank top with a fan going like this. Because if you know what I mean, or it's going to be really late at night, right, Rev? Because right now it is so humid out there. It is not funny. And we got to get his shows back. Because I don't know. I think you're going to be scared when you find out more about me. I don't know. You're lucky you got back in the crisis, like, you know, but this is what you get when you get.
Okay, lady.
No, we're not playing the Animaniacs. Because, I mean, Rob does a very good Yakko.
I can do a pretty good Yakko myself, too. I
don't
know
know.
Wacko. I love him. Yeah.
Wacko, you can do better. Yes.
It's been a while since I did Yakko, though. I just had to think about it. The Wacko is very easy because it's a British accent. You know,
Yeah,
it's
but
like
that's
Ringo.
close. That's close. No, that's actually close because I met all three of them. Remember Comic-Con?
What throws me, one of the voice actors, there's 4 of them. So I don't know if the one that did the voice of, say, Pinky was imitating the
No,
voice of
that's
Yakko.
Rob. That's
Okay,
Rob.
that's Rob.
That's
So
Rob.
Rob was there, but there was
Rob does the voice of Pinky, Yakko, Raphael, and now Donatello because he switched roles with the new Turtles.
they had 3 guys and then the lady.
That's Tess, where she does Gadgets. That's Gadget's voice.
So it's like they were just together. So it's like someone who actually did one of the voices as well. It's like, okay.
Well, look at Jim. Jim does Tigger, Pooh, and everybody else, and even your Star Wars characters.
And even Billy West, when he took over.
Billy, I love Billy. Billy gives me kisses when I see him. Billy is so sweet and everything. He's posed with it. Oh, I'm surprised Christian didn't use that one. I sent that. I'll send it to you right now. Billy has posed with the TARDIS. Billy loves me. Billy and me go way back. Where is it? I'm going to send it to you right now. I think I sent it to Christian. Hold on. Where is it? Let me see if I sent. I know I sent it. I had to have sent it before because it's like, where is it? Let me see. This manage. No, it should be right here because I sent all those pictures. Where is it? Yes, Billy has posed with it. I sent it to you right now. Billy, I love my Billy. He's so sweet. He's so kind. He fry. He doctor.
Great news, everyone. We're all going to die.
He's Stimpy. I love Billy.
I
hope you're watching. I love him. I miss him. This is why I tell people, please be nice so you don't know who people know. I love Billy. Billy knows the show. See? That's Squishy before Squishy picked up some soot over the years. Because we just celebrated the 14 or 13 anniversary. 14 of
Going by
TARDIS.
the Facebook page first.
Yeah. So yeah. Billy is like people don't realize. I mean, I even have, let me send you this one. A lot of people might not know, and this one, I can send you this one. Oh, this one you're going to be mad about. I'm sending you that one. Like, I've met a lot of people in my travels with that TARDIS. I know, you just spotted a couple of them I just sent you.
I had to take down the word alleged because you do know this. I think alleged about it. You do know them.
No, I do know them. Yes.
Yeah. We should post them for TARDIS because we're finishing up this episode.
Yeah, we're just finishing up the episode because we had just come off of TARDIS. And we also, you know what I mean? I put these in for alleged because a lot of people, like I said, even though I have the proof, don't believe me. That's why I want you to put alleged with all this when you show the pictures because look at what other people have been I have posed with the TARDIS. That people say I don't, oh, it's not true. It's not. Yeah, okay.
It has to be done. They have to be put on the Facebook page. I don't know about the web. I don't know about the web page, but the Facebook page.
The Facebook page should have these in the albums.
Yes.
They should be on the TARDIS page albums because I made albums because I have access to make the albums. That's why you saw Squishy with The Walking Dead, because I was walking by at Comic-Con and I'm like, aren't you from, and he goes, yeah, I'm also in this one because I can't say a certain witchery franchise because they play in Walking Dead and the witchery franchise. And they were telling me about the fat suit they had to wear. Yeah. So that's what I'm saying. But these are older shots of things I've had, like, and I know people from over the years. So I know some of them you're looking at, like, especially, like, you know what I mean? Like, you would, like, the ones I just sent you on Facebook, like, the messenger. You saw that? That's what I'm saying. These people all gave, like, permission when I did it because, you know, and it's funny how somebody said when they went to the UK and the TARDIS was there. And I'm saying to myself, okay, so who knew about the TARDIS back then? You know, because I did have an X over there, you know, that was supposed to grab theirs. We did have one in the UK that was a TARDIS, you know. So what do you think? I've lived a very good life with that, right?
Mm-hmm.
The only thing now is I've got to get more stars, more people, and more of my friends to actually understand. I need help. But I don't need people telling me what my truth is when I know my truth. And it is sad because I missed out on a lot because of a family situation that 90% of my friends understand. It's that damn 10% that are mad because I'm not catering to them anymore, or I'm not like giving them freebie things and stuff anymore and stuff, because what have they done for me? Nothing. According to my sibling, I am in a la la land baby world that I need to get a real job and real this and everything. But with my dyslexia, I gravitate more to the entertainment and crafting fields, the creative side. A 9 to 5 does not work for me, especially now that the stuff that I could do, a computer's doing right now. That's not alleged. That's why you don't see alleged there. Also, they feel I'm a hardship being learning disabled because they don't want to pay to have the tools that can make me work, but not at 100%, maybe 90%, 95%, because nobody is 100%. But to tell me every day that I needed to be 100%, while everybody else could do what they want and eat fried chicken at the counter while taking care of a person, or the supervisor making popcorn in their office for that same person, while I'm friggin' there starving my ass off because I only get a friggin' half hour and I have no way to get to places, while they all have an hour lunch and disappear for hours in the bathroom and do whatever they wanted. Oh, sorry. Calm. That's why we didn't put alleged there. Calm. Because that was all not alleged. Oh, and people finding out your medical history too. So what was the point of me? I would just say, yeah, this is what I have. You're going to find out anyway. So, because you had that one person that would tell everybody in the office everything, who they thought was me. And then guess what? I get let go. And it's like, oh, I guess she wasn't the problem. Gee, I wonder who the problem was. But yeah. Because when my name gets mentioned, this one person in the situation gets shivers down their spine. It's like they fear if I was to walk into that place, I don't know, I'd be like, hi and bye, because I'll be like, you know what? I'll go to another location. Because I'll be like, oh no, I forgot. I can't go to this location. I gotta go to another location. But then I gotta make sure the other people that cause the problem aren't at another location. And then you find out, because people are calling you asking, are you paying $125 for a retirement party? Because in case there's some spies here. And I'm like, excuse me, who are you? Because where were you when all this was going on and everything and stuff? Oh, we just didn't know if you wanted to come because, and I was like, excuse me, what? And when you figure out where the place is, because people are calling you to find out because you used to live in that area or grew up in that area, And they wanted to know if you ate there. I called the place, and it turns out that they've changed the menu, because the last time I was there was for my grandmother's funeral in that area, let's say, because we had the brunch for my grandmother at Rory Dolan's up here in Westchester. But that was in 2005, 6, I think, or 3. No, wait. That was in 2003. Yeah, because Haley had just been, yeah, sorry. Oh, you know what? I don't care. I don't care. They'll figure out who it is, because people know me. They know who that is, And that's the thing. When you don't know what's going on, why don't you ask me? Because the baby boomers like to hide things. And at being an ex-centennial or a baby Gen X, I have the bite of a Gen Xer, right? But I'll hear you out as a Generation Y centennial. I'll see the both sides. But remember, a coin has 2 faces and 2 tails. What are you going to tell? And who are you going to talk to? Because I tell people now, talk to the hand, right? Well, back of the hand. I hate this. Welcome to the world of now, where you have to prove you are human. And you can't have fancy foo-foo stuff anymore because people ruined it. But the greatest thing tonight was opening a fortune cookie. And with everything going on right now, this is the funniest part. And why I almost choked on TARDIS was, people may doubt what you say, but they will believe what you do. And what I do is tell my truth. And it says, my determination will be the shining example to others. Well, yeah, I am determined to get both shows back off the ground after they were ruined by people. I am determined to show people that I am not what other people make me out to be when they are jealous of things. And I'm trying my best to help others who are in my same situation with polycystic ovary syndrome, which is now PMOS, and other things, because we need to speak up. The crazy part is that the last fortune in here said love and romance will flourish in December. Now, me, I don't know. I know what he's getting because of my psychic friends and everything and stuff, allegedly. But for me, I wait and see, because you never know what happens, because some things are better after dark. Bye, guys.